Hello, I'm Dr. Mark Mao from Chiro Matchmakers. Super excited to be with you and bring you our Pro Tips series where we're going to focus on having a successful relationship with your associate doctor. Now, I know there's going to be a wide range of listeners to this. You may be in practice, have had 2, 3, 4, 10 associates, and maybe you'll hear something just to make it a little bit better. You may be in a relationship right now and have an associate that's not performing, aren't happy with your relationship, and maybe you'll hear something to actually improve that and turn that relationship around. You may be to the point you haven't had an associate, or you're going to be looking at hiring an associate in the next few months or a year. This is going to hit perfect for you. There's those of you who don't know if you're going to have an associate maybe 3, 4, 5 years down the road. So you're going to hear this way earlier than a lot of people. And you may be an associate looking for a job or looking for a better job. And hopefully you'll get something out of this so you find and understand the right doctor to start to work for. So Chiro Matchmakers has been doing placements now for 5 years. We help doctors find associates. We help associates find doctors. We are matching, right? But we want it done right. Between myself and my 2 partners, we've had 60 plus associates over the years. And I'm going to tell you, lots of great relationships, lots of success. But I'm speaking from scar tissue personally, and I had a couple of those relationships went sideways because I didn't do it right. There are $100,000 issues that took place that if I would have just taken the time and understood what we're doing right now, I would have been way more successful. Now, what we've created is we've created an infographic and what it's called Successful Associate Roadmap. And there's really 10 steps along the way. I'm going to do a deep dive into each of these as we move forward in a webinar. But what I want to do is stay high level first. If you would like that infographic, down below in the comments, just put roadmap. We'll get that sent your way. But what I want to do is I want to dive in. I want to start with pro tip number 1. And pro tip number 1 is what I frequently get asked on a phone, when I'm at a seminar, when we're presenting, and they ask is this: how do I know when it's the right time to hire an associate? Now, to be honest with you, huge question, right? It's complicated, it's complex. And the reason why it's complicated and complex is because each of you that's listening is in a different situation in your practice, in your career, in your office, with your team, and so forth. So high level, there are really 5 questions or criteria to start to ask before you can actually answer, are you ready for an associate? And I'm going to do a high level insight into each one of those 5 questions right now. So number 1, is your practice systematized? Does your practice have systems, processes, and procedures that's successful not only for your patient, but for your team around them? That has to be the foundation that takes place before you can even start thinking about bringing an associate on. Number 2, is your team established and mature? Is it stable? The worst time to bring in an associate, or the best way to ruin an associate relationship, it will go sideways if your team's not on board and on the same vision, path, and goals than you are, and you bring in an associate, I'm going to tell you that that relationship isn't going to work. Now, just to give you some insight, 67% of all associateships end within 18 months. Why? Because of the criteria not being met before you go into the relationship. Number 3 part of this component is, do you have a training culture? I'm going to tell you, if you want to bring on an associate, this isn't a plug and play situation. I have docs call me up and they're like, hey, I need an associate. My office is growing, or I'm losing an associate. I just want to bring somebody in and plug them in and ready to go. If you are going to bring in an associate and to really make a great associate out of that doc and a great experience for both of you, I'm going to tell you this: you have to want to mentor, you have to want to coach them, you have to want to develop them, because you just can't plug and play. I'll give you a sports analogy. Tom Brady this year left the New England Patriots and he's going to Tampa Bay. And I'm going to tell you, they're just not going to plug and play Tom Brady. He's been practicing with his teammates all summer, with his receivers. He's learning the playbook, the quarterback playbook. And I'm going to tell you, what you need to make sure you have is you need to have a DC manual on hand so they can learn the systems and processes in your practice. There's no plug and play. It's developing. It's making sure that this person comes along and you're mentoring them. And that's what we do when we make great associates. Number 4, can you afford to pay an associate DC? Now, this is the call I get often. Hey, I've had an associate with me 12 months, 2 years. And here's the issue. I'm making less now than I did before because I'm paying them my profit. What am I going to do? Are they a bad associate? Is it a bad situation? And I'm just going to tell you that you didn't know if you could afford that associate. And I'm going to tell you that the number 5 criteria plays right into that. And can you bring in enough new patients to support this situation? Can you bring in enough new ones? Can you put the gas pedal down and bring in new ones because your new marketing developer is bringing in new patients? You have your internal, your external, and your social media, LinkedIn, that you guys are getting enough new patient flow that this doctor can help you grow that practice. Or what some of our docs do is they're actually doing some handoffs with their patients, and the associate doctor is caregiving. They're adjusting, taking care of them, while the owner, a lot of times, or another, maybe a business building type doctor, they're coming on top, and what they're doing is doing maybe day 1, day 2. So what you need to do is we need to dig into what are you looking at accomplishing with adding an associate. Are you looking at free time? Are you looking at, increasing focus? Are you looking at possibly, making and producing a satellite office? These are all things that need a deeper dive, and I'm going to go into those as we move forward in the pro tips. But what I wanted to do today is really to keep it high level. Hey, how do I know when to hire an associate? Hopefully I kept this sweet. There were some nuggets in there you can take away, but if you want to dive deeper, you want to learn more about this information, what I'm going to be doing is I'm going to be doing a free webinar at the end of the month. August 27th at 8:30 Eastern time. I'm going to dig in for half an hour to 40 minutes unpacking this chart right here, this infographic, the 10 steps on who do I hire? When do I know when to hire? How do I hire? How do I find the right associate doctor to link in with the mission or what I'm trying to accomplish? So I'll do a deeper dive that evening. But there's a lot of you right now, if you're like me, I love to take action immediately. If I hear something I like, I want to be able to do it now. So if you'd love to jump on a brainstorming session with me, down below in the comments, type in brainstorming. What we'll do is we'll instant message each other and get a time set up that I can actually talk down what your situation is personally, maybe a 15-minute, 20-minute phone call. But what I'd love to tell you is this, is that, you know what? I lost 6 figures from a wrong hire, okay? What I'll tell you, I can help save 6 figures if we can get it done right first. So let me know, brainstorming session in the comments below. I look forward to our next pro tip session next week. Talk to you soon. I'm Dr. Mark Mile, Chiro Matchmakers. Thanks. Bye-bye.